The overall goal of this procedure is to estimate contraction velocities, strain, and strain rate of the rectus femoris muscle with sub-millisecond temporal resolution during a drop landing task using vector tissue Doppler imaging. This is accomplished by first preparing the subject by placing reflective markers on the subject's lower limbs and the transducer on the subject's thigh. Next, the subject is asked to stand with arms across the chest on the middle of the motion capture volume, and a static trial is captured. Then, while standing on a platform, the subject performs the drop landing task by dropping from the platform and landing with both legs simultaneously. Ultimately, results can be obtained that show the rectus femoris muscle kinematics during a drop landing task through vector tissue Doppler imaging, as well as quantifying joint kinematics and kinetics using the motion capture system.
The main advantage of this technique over other existing methods like 3D motion capture and electromyography is ultrasound imaging can provide direct estimates of individual muscle motion. Additionally, vector tissue Doppler imaging has several advantages over currently existing ultrasound imaging techniques, since it can provide both the magnitude and the direction of muscle motion at very high frame rates, especially in activities like drop landing.
This method can answer key questions in the fields of biomechanics and rehabilitation science by providing quantitative measures of musculoskeletal kinematics during dynamic tasks.
This method can be applied to understand the pathophysiological process of degenerative disease, such as the early onset of osteoarthritis post-anterior cruciate ligament injuries. This is because we can concurrently quantify joint mechanics and musculoskeletal function during dynamic activities to understand